So I think that there is a simple solution to the engagement issue that pharma are having now with healthcare professionals. And spoiler alert, I really don't think it's about building digital capabilities and pushing out content to healthcare professionals across new multiple channels that you haven't done before. I think quite simply, it's not enough just to produce more content on those channels, because I think the reason why healthcare professionals don't engage is due to the value of the content rather than where or how you're sharing it. So the solution to the problem, I think, is about owning your media and not renting it, and also creating valuable content. And what I mean by owning media rather than renting it is to stop relying on third-party channels to get the engagement that you want. I think the problem with this attitude that doctors don't trust our channels and therefore we must push it on third parties means that you're never going to own that engagement. You're never going to get the data, you're never going to generate the leads, and you're never going to know if you got good return on investment. So what you should be doing when you're engaging with third parties is thinking, how can I get the audience who are on the third party channel to trust my content, engage with the content on my channel, sign up or become a lead or become engaged with my community and come back to us regularly rather than always going back to that third party channel. And the problem is, I can probably hear you all saying right now, we can't compete with that. We can't build that level of trust. We have a fundamental issue that people think we will be biased. We can't produce content that quickly or of that level of quality. And I don't think that's actually true. I think that pharma actually have a number of advantages over publishers. If we really think about it, the core difference between a scientific publisher or medical education channel or news channel that is producing promotional content that's paid for by pharma companies is where the money comes in. So for one of those publishers, let's say something like Medscape, they're in a constant battle, right? Who's paying the bills? Pharma companies and industry. Who's digesting the content? Healthcare professionals. So what they're constantly having to do is battle these two masters. We're going to have to produce content that people who advertise on our channel want to create, but at the same time having to produce valuable and interesting content for their audience. So there is a constant conflict there for any publisher, is where that sponsorship and where that advertising money comes from. For a company, a big pharmaceutical company or a biotech, you don't have that challenge. You know that all that you want to do is to get people to use your product or your service in a situation where it's relevant for that particular patient. And the great thing is that you don't have to sell that content. You do not have to advertise on that content. All you need to do is understand your audience and produce really great, interesting content for them to engage with. And your goal will absolutely be to get engagement on that content, to get people to come back, to learn about your audience so you can market to them with relevant, interesting advertising content. And so when they do come across a situation where they need your product, they're going to go to your site, they're going to trust you, and they're going to engage with you. Not only that, but when you actually have customers, those customers will value your brand and your company so much more if you continue to engage with them and you continue to produce relevant, interesting content for them. So I really think that solution to the engagement problem is not to just accept that healthcare professionals do not want to engage with pharma content because they inherently distrust it and therefore just decide, we'll just put that content somewhere else where they will trust it. I don't really think that's true. I don't think that you can just say, if you put promotional content on a third-party channel, then all of a sudden doctors will trust it because they trust the channel. I really don't think it's true. I actually think that we can earn that trust back by thinking and acting like publishers and actually competing with them for the audience, or at least working with them to produce campaigns that end up in leads that are in our hands so that we can start to build those relationships. So then the important question is, how can we actually behave and act like publishers? And maybe the solution is to start to work with agencies or to work with our own marketing teams and have the capability to produce and tell stories that speak directly to the audience. Maybe it's collaborating and working with the audience to tell and share stories of success or challenge that have been overcome and that people will be interested in. So I think it's a mindset and getting that resource in-house. I also think that from a capability perspective, if you think about the budgets that industry have to advertise and you think about how much money you spend on advertising for your brand, I wonder how effective it would be if you were to reinvest some of that money into building the capability to publish and approve relevant and interesting content to your audience. I can guarantee that there are a lot of small publishers and channels that get a lot more reach and a lot more engagement than pharma or industry on a much smaller budget. Even bringing that capability through an agency would cost a lot less probably than a lot of the advertising budget that goes to multi-channel, and it's not content that people want to interact with. So I think there's a simple solution. I think that there is a lot of work that can be done. I would be really interested in talking to any pharmaceutical leaders, whether you're medical, marketing, market access, to think about how you can think a little bit more like a scientific publisher. I'd be interested in if you've tried that approach, or if you're interested in trying that approach, because I would love to see the amazing content, the amazing quality, and the value that I know industry brings to the audience, actually reaching that audience and getting engagement. So next time that you do a campaign, if you're going to use a third party, think about what your goal is. Your objective should always be to own that data, to own that media, and bring the relationship from the third party to your own channel. So I hope you found the video interesting. If you liked it, please hit the like button and comment if you have any suggestions for improvements or any ideas of your own around content marketing for pharma and biotech. If you want to access more great content like this, please make sure you subscribe to the YouTube channel. You can also follow me on LinkedIn, as I'm always posting on content like this, not always video based. And if you do want to talk to me directly, or you want to talk to someone from the agency about content marketing, then please do visit brandcasthealth.com, fill in a content form, and either myself or someone else will get back to you. And we'd love to talk to you about how you can improve your content marketing, whether you're in a pharma, a biotech, or a device company. So thank you very much for the support as always. Have a great day.